I'm Dr. Suvro Banerjee. I'm a cardiologist at Apollo Multispecialty Hospital in Kolkata. My talk is on the role of CT coronary angiography in patients with chest pain. As you know, for patients presenting with chest pain, we have a host of diagnostic tests that could be done. And apart from the basic tests like ECG, echocardiography, and cardiac biomarkers, we also have functional stress testing such as exercise ECG, determined stress echo, SPECT, cardiac MRI, and so on. And also anatomical tests like CT coronary angiography and invasive coronary angiography. I think the question is, which test would be most appropriate for which patient? Now, let us first look at patients who are coming with chronic stable chest pain and suspected of having chronic coronary syndrome. The ESC guideline says that for these patients, first you find out, you look at the patient's age, gender, and the nature of symptoms. And from this, you assess the pretest probability that this patient may be having significant obstructive coronary artery disease. Now, once you have done that, if the pretest probability is very high, then this patient would be going straight ahead with invasive coronary angiography. On the other hand, if the pretest probability is very low, then these patients really do not need further testing in most of the cases. But for those patients who are in the intermediate risk group, we have to offer some additional tests, and which could be either an anatomical test or a functional test. Now, which test would you go for? That depends on the clinical likelihood of the patient having significant coronary artery disease, in other words, the pretest probability of the patient, and also on the diagnostic accuracy of the test in question. Besides, you also have other factors such as like patient characteristics, availability of local expertise, patient preference, and others. But let's go on to the most two important aspects. Now, what the literature shows is that CT coronary angiography should be the preferred test in patients who are at the lower end of the range of clinical likelihood of coronary artery disease, because their good CT coronary angiography is good in excluding or ruling out patients with coronary artery disease. On the other hand, patients who are at the higher end of the range of clinical likelihood of the disease, they should go for a functional stress testing, because those are good in ruling in patients with coronary artery disease. And one point I would like to mention here, that exercise ECG or treadmill testing has a very low diagnostic accuracy and should be avoided in patients with to diagnose chronic stable angina in patients with stable chest pain because of this. And also patients who have certain characteristics like very obese or very fast and irregular heart rate, they should not go for CT coronary angiography because the image quality may not be correct. And also the similar thing holds for those with extensive coronary calcification. Now, let's move on to patients who are present with acute chest pain, and you want to diagnose or exclude patients with non-ST segment elevation MI. Now, traditionally, as it has been seen, like if you add CT coronary angiography to such patients, then they would reduce the stay in the emergency department and in the hospital, would reduce cost, and patients could be more safely discharged if the CT coronary angiography is normal. However, now we know that high sensitivity troponins are available, and it has been shown, the studies have shown that in the current era, this advantage of CT coronary angiography is no more there. In other words, we should not be referring patients with chest pain, with suspected acute chest pain for CT coronary angiography, because high sensitivity troponins can do this more safely and also sooner. But then the question is there any place for CT coronary angiography at all in our current day practice? Now, the studies have shown that in patients who are presenting with acute chest pain and have low to intermediate risk of coronary artery disease, and the ECG and the troponins are either normal or inconclusive, but you have a high suspicion of acute coronary syndrome. In such patients, CT coronary angiography may provide additional value. And that is because CT coronary angiography has been seen in such patient to reduce the number of referrals for invasive coronary angiography. In other words, CT coronary angiography in this subset of patients could act as a gatekeeper for invasive coronary angiography. However, again, I would like to say that patients who have pre-existing coronary artery disease, or they have had coronary bypass surgery or stenting, these should not be subject, such patients with acute chest pain should not be subjected to CT coronary angiography as a first line. Thank you.